Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.
Hi guys, once again it's Skills here, your favorite host. Welcome to another thrilling and exciting episode of the Healthy Happy Human Show. Today we have a lovely guest in the studio with us. It's no other person than Dr. Chioma Peters. Dr. Chioma Peters, you're welcome. It's a pleasure having you today.
Thank you so much.
Today we'll be discussing a very interesting topic that is relevant in our society today. We'll be discussing polycystic ovarian syndrome. So Dr. Chioma, please tell us, what is polycystic ovarian syndrome?
Okay, so polycystic ovarian syndrome is a hormonal disorder that affects women with, or that affects people with ovaries. So it's one of the commonest endocrine disorder, and it usually affects women with ovaries in their reproductive ages. So this there are so many symptoms that it's associated with, and it actually varies from person to person.
Okay, interesting. So how common is polycystic ovarian syndrome in our society today?
Well, it's actually quite common. Like I said, it's one of the commonest endocrine disorders. So you tend to find it like in quite a number of young ladies. Some people might not actually know that they have polycystic ovarian syndrome because maybe there's been no need to get checked, or maybe they don't have a particular symptom, probably until when maybe they want to conceive, and then they present to the hospitals, and then when some tests are done and some checks are done, they will now realize that they have polycystic ovarian syndrome.
Interesting. Thank you so much for that. Okay, so what are the risk factors of polycystic ovarian syndrome?
Okay, so there are quite a couple of risks that can predispose someone to having polycystic ovarian syndrome.
Okay.
Anyways, it's needful to say that not everyone with this risk can actually have the polycystic ovarian syndrome. And also some people who have this risk can actually not even have the polycystic ovarian syndrome. So there is no known cause as per se that you say, oh, this is the reason why somebody has this. But there are some certain risk factors that can increase a person's chance of getting polycystic ovarian syndrome. And one of these is genetics.
Genetics, okay.
Yeah, or family history. So if a person has, maybe your mother or your sister was diagnosed with polycystic ovarian syndrome, there's a high chance that you would also have PCOS.
Interesting.
Yeah. So another risk factor is hormonal imbalance.
Okay.
So when the hormones are fluctuating, for instance, if a woman's androgens, so androgen is the men hormone. So if it's being produced more, so that person is also at a risk of getting polycystic ovarian syndrome. Another risk factor too could be obesity. People who have extra body fats, whose BMI, body mass index, is higher than normal, maybe who are overweight or obese. Yes, they also have a higher risk of getting PCOS. Also ethnicity. So PCOS is common in some ethnic groups like the Afro-Caribbeans, the Asians, and also like Afro-Caribbeans, blacks. So ethnicity also plays a role in PCOS.
Okay, interesting. So we're going to progress.
Okay.
Could you please tell us some of the signs and symptoms of PCOS?
Okay, so the hallmark, the most common symptom of PCOS is actually irregular menstruation.
Okay.
So women or ladies who have PCOS tend to have irregular cycles. So some people actually have like less than 8 cycles in a year, and some people might actually not even have their periods at all. Yeah, another symptom is something we call anovulation, meaning that the lady would not ovulate. So this is because the ovaries do not produce eggs.
Oh, okay.
And so if there are no eggs, you're not ovulating, and then there will be a problem conceiving. So some other risk factors include hirsutism, that's facial hairs or body overgrowth of hairs. Normally, there is men who have hairs, but you see some women who have like facial hairs, especially around their chin. They have like beards. So this is because of the androgen that is being produced excessively. So this is also another sign of PCOS. Yeah, some other symptoms to include acne. So women with PCOS tend to have more breakouts, like they have acne all over their face, their forehead, their chin, their back. So these are some signs, called the common signs and symptoms.
Common signs. Thank you so much. So could you please also tell us what lifestyle changes or that people could make to deal with PCOS?
So there was something I missed out, something called insulin resistance. So it's also a risk factor of getting PCOS. So what happens is that normally, even in somebody who comes down with PCOS, the first thing you'd want to tell the person is lifestyle modification. So that's the first thing, even before you start talking of medications. So losing weight plays a very big role in managing the symptoms of PCOS. So when you're talking about lifestyle modification, you talk about diets, you talk about exercise, you talk about trying to reduce stress factors, like anything that would cause an alteration in your hormone level, you try to avoid it. But most importantly, diet, exercise, and trying to lose weight, so that so all this help in regulating the hormones and controlling some of the symptoms that are associated with PCOS.
All right, interesting. You've heard it for yourself. Lifestyle modification, try to lose weight, and also try to reduce activities that might induce stress. All right, Dr. Chioma, other than the lifestyle modifications, what other maybe drugs or other ways that PCOS can be managed? Could you please tell us more on that?
Okay, so depending on the symptom, for example, if the patient is dealing with hirsutism, that is overgrowth of hairs, there are like creams that are available that can actually slow down the production of androgen and furthermore decreasing the production of hairs on the face. And most importantly, the major concern of PCOS is the conceiving, not inability to conceive. So there are drugs that are actually helpful for this, like clomiphene citrates. So if a woman is not ovulating, these drugs are given to induce ovulation. So once a woman is ovulating, the chances of her getting pregnant is high. And also for women who have irregular menstruation, they can be given the oral contraceptive pills, combined oral contraceptive pills. This also helps to regulate the menstrual period, it makes it more regular. Yeah, so just depending on the symptoms, for acne, there are some topical treatments, benzoyl peroxide, and also if benzoyl peroxide doesn't work, like if topical treatment doesn't work, there are also medications that can be prescribed by the specialist, endocrinologist, to help depending on what symptom or what problem that the person is actually worried about.
Okay, interesting. Thank you so much. So earlier on, you mentioned that one of the challenges of PCOS is issues with ovulation. Some maybe people are unable to ovulate or have irregular ovulation. So if that happens and they are unable to conceive, are there other alternatives?
Of course. Thankfully, science has modernized in such a way that even things that our forefathers didn't expect could happen, is happening. So if for any reason, maybe the drugs are not working, there are so many other options. There's surrogacy, there is IVF, there's so many options available for women who are not able to conceive because of PCOS. But in most cases, the drugs are actually able to help induce ovulation, and the women can actually conceive by the help of the drugs in most cases. But in cases where maybe it's not, there are so many options that are available.
Okay. Thank you so much. Thank you so much. So it's been a pleasure speaking to you, Dr. Chioma. And before we go, we would like to hear your final thoughts and advice to our viewers out there.
Okay, so polycystic ovarian syndrome is a very common endocrine disorder that affects ladies in their reproductive age. So if you're having any symptoms that I've mentioned earlier, like acne, irregular menstruation, inability to conceive, hirsutism, or you're dealing with obesity, this could be some pointers that you actually have polycystic ovarian syndrome. And I would say you go to a good hospital close to you and have yourself checked, and also know that there are medications available and also lifestyle modification that help greatly with PCOS. And if you have problem conceiving, there are also medications that can help induce ovulation, which can help you conceive. And there are also psychological supports and so many supports out there for women with polycystic ovarian syndrome. So PCOS is not the end of the world.
All right, guys, you've heard it for yourself from Dr. Chioma. Early diagnosis is very, very important. So go to the hospital if you're experiencing any of the signs and symptoms. Get yourself checked. Lifestyle modification plays a very, very important role. Once again, don't forget to drop your questions in our comment section, and do well to subscribe to our YouTube channel. Turn on the post notifications so you get notified when we drop our amazing and juicy content. Also, follow us on all social media platforms: Instagram, LinkedIn, YouTube, Twitter at Healthy Happy Humans. And here is your favorite host, Skills. Till next time.
Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.